You're in the shower or getting intimate, and suddenly you notice it, your penis curves. Is that normal? Should you worry? Or is this just part of aging? Today we're breaking down what a curved penis means, when it's completely fine, and when it might need medical attention. Hi, I'm Dr. Zoe Hartley. If you're a man over 50, this channel is where we talk honestly about your body, your health, and the changes no one warned you about. A curved penis might feel strange, even embarrassing. But trust me, you're not alone. Let's walk through the facts. Believe it or not, a slight curve is totally normal, even when you're younger. Many penises curve slightly to the left or right, or even upward. It's just how your body developed, similar to being right or left-handed. As long as the curve doesn't cause pain or block penetration, it's nothing to worry about. So if your penis has a mild bend when erect, especially if it's always been that way, that's perfectly normal. Now let's talk about when a curve might signal something else, especially if it appeared later in life. This condition is called Peyronie's disease, and it's more common than you might think, especially in men over 50. What is Peyronie's? It's caused by scar tissue called plaques that forms inside the penis. This makes one side less flexible, causing a sharp bend, usually upward or to the side. It can also come with pain, erectile issues, or shortening. What causes Peyronie's disease? Microinjuries during sex. You may not even notice. Genetics, it can run in families. Connective tissue disorders. Aging, natural loss of tissue flexibility over time. Risk increases with diabetes, erectile dysfunction, certain prostate surgeries. In short, if your penis suddenly develops a noticeable curve in your 40s, 50s, or beyond, don't ignore it. So, when should you talk to a doctor? 1. If the curve is getting worse. 2. If sex is painful or difficult. 3. If you notice lumps or scar-like tissue. 4. If you're feeling anxious, ashamed, or confused. Treatment options include prescription medications that soften scar tissue, penis traction devices, clinically tested, not gimmicks, injections, and in severe cases, surgery. The earlier you catch it, the better the outcome. Here's the bottom line. A slight curve is normal. A sudden or painful bend could be Peyronie's, and it's treatable. And none of this makes you less of a man. Your body is allowed to change. That doesn't mean you're broken. It means you're alive and aware. If this helped you feel more confident or less confused, give it a thumbs up. Subscribe for more straight talk about men's health after 50. And check out our next video. What is morning wood? And what if I stop getting it? You deserve answers, not silence.